sorry, Muhammad Kamal, I'm really sorry. Can we start?
Yes.
I'm glad Muhammad remembered. We just started the recording. Can we start from the beginning again?
Okay. Hello, sir. My name is Dr.
Good
Kamal.
time again, Muhammad.
Okay, sorry.
Yeah.
You can start, Muhammad Kamal.
Hello, sir. My name is Dr. Kamal. I am one of the surgical team working with you today. Is it okay to speak with you?
Yes.
Okay. May I confirm your name and date of birth, please?
Miss Omar, my age is 25.
Nice to meet you, Mr. Omar. Today we are going to do for you some procedure called chest tube. We want to do it under local anesthesia. It won't take time, but it's sometimes bothering you, but it will be going fine with you. Is it okay with you? Okay, let me check your paper medical records. Your name, your age, and your consent is signed. Oh, okay. This procedure, actually, we're going to do it under local anesthesia. It won't take time. It will be stay with you according to your condition, and we'll keep follow up with you. This with us with the serial X-rays and serial imaging, and we'll make sure that your chest and your health is okay. Sometimes there is some kind of complication. Could be bleeding, could be some kind of chest tube obstruction, tube to dislodge, some kind of air accumulation in your skin. But we will follow up according to this. Is it okay with you?
Yes.
Okay. Now, would you please raise your hand up? Yes, like that. We're gonna do it for you here. Okay, sorry. All right. We will watch.
I'm your examiner, and I will be asking you question while you're doing your procedure. Okay, just continue doing what you do.
Okay.
I will ask you a couple.
Okay.
I will ask you a couple of questions.
Okay. Wash my hands. Complete septic condition. Surgical gloves. Okay. Do you have any sensitivity, Mr. Omar, about calcium gluconate or any bovidine iodine?
No.
Okay. Okay. We're gonna drop it.
Okay, can you tell me about your landmarks that you're gonna use?
Okay. About landmark, we're gonna use the safety triangle area, which is bordered by anteriorly from the lateral border of the pectoralis major, posteriorly the mid-axillary line, inferiorly fifth intercostal space. We want to make sure that this operation will be done to this safety margin anterior to the mid-axillary line to be well prepared of long thoracic nerve injury.
Okay.
We're going to take a look at anesthesia here. Okay, my friend. Gently, my friend, okay? It will not hurt you for you. Second. We're going to expose you first, okay? We're going to expose him first after section. Right. Right. So close. Okay. Second, third, fourth, fifth intercostal space. Mid-axillary line here. Gently, my friend. It will be hard for you. We're gonna put local anesthesia here. We're gonna wait about 5 minutes for the local anesthesia to start.
Okay. Continue what you're doing.
Right. You feel any pain?
And make sure.
Okay. Yes, my friend.
Yeah, continue what you're doing. I'm asking you a question, and if you can just put the needle away so you don't harm him by any means, of course.
Yes, the needle is far. Yes,
all right.
It will be far away.
What are the indications for contacting thoracic surgeon following chest tube insertion?
If there is massive hemothorax or pneumothorax from the start, that indicate a bronchial injury, or if there is from the start the drainage of more than 1,500 blood initially, blood from the chest, or there is bleeding more than 150 to 200 blood come from 2 to 4 hours, or if the patient severely hemodynamically unstable with hypovolemic shock need blood transfusion.
That's fine. While you continue what you're doing, how do you manage the risk of damaging the intercostal neurovascular bundle during the insertion of the needle?
We want to make sure that we will do our operation at the superior aspect of the chosen rib to protect the neurovascular bundle, which goes from in the inferior border of the rib.
All right.
Now, we're going to use plate size 11, right? Gently, my friend, okay? Very gently. We're going to just put one hole inside, okay? Right.
All right.
The picture sharp needle out. Right. Now, you're going to feel some kind of discomfort. If it is discomfort for you, please tell me, okay? Put our finger, dissection in the fifth intercostal space with the guideline of thermostatic clip. All right, until we feel popping sensation. Yes, which means that we are in the parietal pleura now. When I separated all the ribs or the pleura.
All right.
Now, we're going to use the chest tube. Make sure that the date of the chest tube is not expired. All right.
How would you assess the need for chest tube in trauma patient?
We want to make first of all a full examination of the patient. The patient, if he's hemodynamically stable, the pulse, the respiratory rate, and the chest expansion of the patient, and the general condition, and of course, imaging of the patient.
Okay. Can you explain the mechanism by which the underwater seal drainage system functions while you're doing the
actually, it will increase. It will make the.
I want you to explain why you putting your tube. I will see you. I will see you. Yeah.
Yes. With thermostat, we're gonna close this one posteriorly, so not to make the ear leakage comes out. Gently with the direction of my finger. We'll put it more deep, 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 and we try to make it at the apex. Now it's in place. Okay. We're gonna use now the stitch for fixation it, size 1 silk. This is the stitch. We're gonna open it and fixate it, and we're gonna connect it outside with the connector underwater seal to make it, is it function or not? You see the fucking and the movement with respiration. If it is mobile, we're gonna fix it to the skin suture mattress, and we're gonna also throughout the operation make sure that the patient is okay. Full pulse oximeter, pulse, respiratory rate, chest expansion, and do X-ray to confirm the function of the tube.
All right. Do you have a water seal here?
Yeah.
Do you have any bag or any?
Yes, the water seal, but I don't have it. Yes, it's here. Yes.
Okay.
And after that, we want to document our operation in the records. We want to take the sharp needle in the safety bin.
Can you take the? Can you put the sharp bin now? Can you discard them now?
Yes. Okay.
Okay. And
yes, it's there. Yes, in the safety bin.
Right.
Yes. But I will do it again for you if
that's
you want.
fine. Describe the criteria for chest tube removal.
Okay, the chest tube removal now, after that, first of all, we want to make sure that the cause of the chest tube incision is removed. There is no hemothorax, pneumothorax finding throughout the imaging of the patient. And the chest tube drainage, it will be 150 to 100 milliliter of 24 hours. And there is no
finish
of the tube. And the patient is hemodynamically stable.
Okay. We answered most of like we just have like 2 questions. And what complications should be monitored for post tube insertion, and how are they managed?
Post tube insertion, first of all, we want to make sure the tube is mobile, it's working, not obstructed. I want to do it prepare of complication, so we want to do it under complete aseptic condition, and we may use pre-op antibiotic according to the hospital guideline, and the follow-up of the tube every daily for imaging and the chest condition of the patient, and make sure that there is no complication happen to the tube, such as surgical emphysema or blockage or hemorrhage or bleeding or pulmonary edema.
All right, cool. Good, Muhammad. Okay, Muhammad.
Yeah, Ahmed
Yes.
Kamal.
Yes.
Excellent. Excellent performance.
Okay. Thank you so much.
I just have one comment.
Yes.
Uh,
Sorry, my friend, to do it in hospital, but I borrow the instrument.
Yes, very good.
Kamal,
we did our best to make it similar to the hospital setting. I think you did a good job making it similar. You cannot make it identical like the hospital one, but what you did is very good.
yes. Muhammad Kamal, you introduce yourself and you explain the patient, the procedure and complication. Just did you take the written consent? Muhammad Kamal? Muhammad Kamal?
Yes, I asked him. I
think he checked.
asked him. Let me check your paper. Let me see your written consent. I asked him.
Okay, excellent. Also, you need to open the chest tube with non-touch technique.
I'm trying that, but you know that
I will give you a tips about this. When you explain
Yes.
the patient the procedure and the complication, reposition the patient and go to prepare your equipment. Open the catheter, open the chest tube without touch, and open your injection and all material that you need to open it without touching. After that, wear your.
Can I ask question, Mr. Muhammad? What do you mean without touching? Can you explain more for me?
Look to your chest tube. Have to.
Okay.
You can open it without touch, because if you touch it by your hands and then insert it to the patient, may high risk of infection.
Yes, I just want to add one point, Muhammad, here. So in this station or any tube or in the catheter station as it's coming, I'm going to bring a catheter and show you what you do. Let me open the camera. Let's say this is the catheter, okay?
Okay.
The catheter will be covered by plastic.
Yes.
There's a catheter and there's the plastic that's covering the catheter. You open the top of the catheter, right? And imagine that the penis of the patient you want to insert the catheter on, or that's a chest, you want to insert the chest tube in. You pull this one, and then you push from the side, you move it this way, You don't touch here. That's what Muhammad mean by non-touch technique. You don't touch here. You just pull this way.
Okay. Good. Thank you for your notice, Doc.
Also, you will find the catheter already in the exam, but the examiner may ask you, what's the size of chest tube that you need?
24 to 30. That's why I thought not to talk too much. That's why.
Excellent.
Until you ask me. Yes.
Yes. Otherwise, I have one last question, which is how to confirm. I think Ali asked it about it, but I need to hear
confirm. Is it in place?
Yes.
To confirm in place, we see the fogging in the tube itself during the respiration of the patient, moving the respiration, and of course the patient is hemodynamically stable, not distressed, and the follow-up of the pulse oximeter of the patient during the operation, and post-op we do X-ray imaging to make sure everything is okay.
Excellent. Excellent.
Yes.
No other question. Thank you so much, Muhammad Kamal.
I appreciate it, sir.
Ali, do you have any comment?
Yes, I have like quick comments. Muhammad, when you ask your patient, Kamal, you said local anesthesia, and we had a deal before to say numbing agent. Don't say local anesthesia.
Okay. Should I see the name of the anesthesia?
No, say numbing agent.
Okay. Numbing agent, because I'm gonna write it now in the paper. Yes.
Yes, numbing agent. And
numbing.
Then
yes.
Numbing, yes. Numbing.
Yes.
From numbing, yes. And
Okay.
then
This all for anything with local
anything with
pasteurization,
anything,
anything.
yeah, anything with local. Say I'm gonna give you a numbing agent.
Numbing,
Before you introduce your needle to the skin, say sharp scratch, like you are
Good.
you are telling your patients that you're gonna feel sharp scratch. Say sharp
Okay.
scratch before you just pull it.
Okay.
And at the end, your patient probably is gonna be a market, like a plastic. It's
Okay.
gonna be it will not be a real life patient because you're gonna suture. It's gonna be
Yes,
like,
that's why I didn't open the suture.
Yeah.
That's why. Yes,
But
I'm trying. If I open the suture, I don't know how to fix it in his skin. That's why.
yes, that's fine. So I when you practice it yourself, practice it on a pillow
Yes. Okay. Good point.
and do even the suture. Do
Good
everything,
point. Yes.
even with the suture, so you know how much time the suture will take from you.
Good.
Okay.
Yes.
Good.
And treat your pillow as a real patient and treat your market as a real patient. Even in the
Good.
exam, thank your patient. Give him a
Okay.
name, even if there is no name. Thank you, Mr. John. Now the operation is done.
Okay.
Even if you are talking to plastic.
Yes.
Okay.
Yes.
I
Ali,
think that's all. But overall, your performance was very good.
I have last advice about this procedure at all.
Yes.
Muhammad Kamal, I see you when
Yes.
Ali asked you during your procedure, you stop to answer, then you complete your procedure. Try
Yes, I'm
to
trying
answer
to
during
make it in the same
procedure.
time.
Yes, that's my
Yes.
point.
I'm trying, but I didn't expect that you will ask me like this.
Yeah,
That's why.
it is very complicated, and I think you did very good at answering while you're doing. But I'm giving
in
a
the exam
general
situation. Yes.
Yes, a general concept for everyone. Ask the questions to yourself or let someone ask you while you're doing the procedure. This is how the exam goes.
Okay. Okay. Done.
The
Yeah.
next session is urinary catheterization.
Can I take a permission? I think, could I take a permission? The other colleague can do it until I prepare myself. Let the other colleague
Okay,
go to the station.
No problem.
Okay,
I'm ready
cool.
now, but just a few touch finishing. Yes.
Yeah,
All
take
right,
your
all
rest.
Okay.
Debridement of contaminated wound. Ali, I think. Debridement of contaminated wound. We'll do the debridement of contaminated wound.
Hello?
Hello, Ali. Are you ready? Hello.
Hello, yes?
Are you ready?
Yes? Yes, 1 minute.
Okay.
In this 1 minute, let me just say a quick thing. Salma Zahran mentioned a very good point. In this station, you may find assistant. If you have an assistant, or when you're doing the station, you can ask, where is my assistant? The examiner may tell you there is no assistant, or the examiner may tell you, I will be your assistant.
This for all the procedure, my friend, or should I
Yes.
ask this question?
For all procedures, most of them, they have no assistant, most of them. But ask, do I have assistant or no? If you have an assistant, then you can use your assistant to do a couple of stuff for you, as the same way that we do in theater. So
Okay.
you may ask your assistant to give you a sharpening. You may ask your assistant to do whatever you want him to do. But the major task, like the suturing and the inserting the tube, that's your job.
Yes.
Okay?
Okay.
Dr. Ali,
Yes.
when I ask the examiner if I have assistant or no,
Yeah.
before I start my station, yani, when
No,
I
no, no.
enter the room, I ask if I,
Oh, no.
or after I introduce
Explain to the
myself.
patient.
Introduce yourself, take a permission, explain the procedure, ask about WHO, ask about the consent. After the consent, just before you start doing the procedure, ask, do I have assistant or no?
One question, my friend. What about the ask? I actually, in my note, I was supposed to ask about WHO list, but I thought that I was confused. Ask or not ask? That's why I didn't ask. Should I
Why?
ask?
Why? You should ask for every single procedure. I didn't notice you didn't ask for WHO.
Yes,
I thought
I didn't ask, but I just raised my voice to make sure the patient name. I said I will check your record, your name, your ID,
yeah.
your
You
procedure.
said yes. You said I will check your record. I think you asked about the WHO.
Okay,
Didn't
okay,
you?
that's why, because I know to ask, but I was confused. How
Muhammad
can I
Gamal,
ask? Yes.
you can ask, I would like, tell the examiner, I would like to check the WHO checklist.
Okay. Okay.
Here the examiner will tell you, already check it. Then there are two questions mandatory to ask about the WHO checklist, which is about the blood thinner medication, because this procedure may have risk of bleeding. Do you use any
Okay.
blood thinner medication? Do you have any allergies? Just
Yeah. Did he ask about the allergy, by the way, Muhammad?
Yes, I asked him.
Yes,
You have any
he
allergy
asked about
to the...
the
Yes,
allergy.
I asked it.
Yeah. Okay.
but
Good.
these two questions
Yes.
separated from the WHO checklist, please.
Which two questions? Allergy and
Do you use any blood thinner medication?
for any procedure.
Yes.
Okay. Done.
Because any procedure has a risk of bleeding. And
Okay.
Muhammad, please
Yes.
add. No, but Muhammad Babikir. These two questions, we need to update every single school station by these two questions, Muhammad.
Okay.
Immediately after the WHO.
Okay.
So all the procedure will be updated by these two questions. And the question of the do I have assistant also, we will add this question to every single station immediately before doing the steps.
Okay.
So we have two updates today.
Alia,
Yes,
are you ready?
yes.
Okay, brilliant. I will put a timer for you. The brightness, right?
I have a question. My patient will be anesthetized already, or I have to give local anesthesia?
You have to give a local anesthesia.
Yes.
And don't forget the two updates we just mentioned now. Assistant and
The
allergy.
updated information, the allergy and blood thinner medication, and do you have any assistant?
Okay.
Let me put timer.
Okay.
9 minutes started.
Okay. Hello. I'm Dr. Alia Musa, one of the surgical doctors. May I confirm your name and age, please?
My name is Mrs. Lisa, 65-year-old.
Nice to meet you, Mrs. Lisa. Today I will be your doctor. I will clean your wound and remove any foreign body. Is that okay with you?
Yes, doctor.
It will be under numbing agent. You will not feel any pain. Okay.
Okay.
Could I now? I want to check WHO checklist. Okay.
Already checked.
Now I will start. I want assistant. And do you have allergy against any latex or iodine?
No, doctor.
Start from centrally to triple and clockwise.
دي فرخة.
Yes.
Jamal, please mute yourself. Can I ask you, Alia,
Yes.
how do you assess a contaminated wound severity and the need for debridement?
Okay, from the extent of the wound and level of contamination and the presence of sign of infection, systemic infection.
Mhm. Could you tell me what are the
And
signs of devitalized tissue in the wound?
okay, it could be color discolored and non-bleeding tissue
Mhm.
and meshy.
Mhm.
Muhammad, can you ask the question because I'm not able to ask the question at the moment.
Okay, okay,
To this station. I will be back in 5 minutes.
okay.
Hello, Muhammad, did you get that?
Yes, could you please mute yourself? I didn't see her.
I will. I'm not available now. I'll be back in 5 minutes.
All right, Ali. Alia, please unmute yourself.
Yes.
Alia, how do you
Yes,
manage pain during the debridement process?
by giving local anesthetic agent and if necessary give anxiolytic and opiate to make patient feel comfortable throughout the procedure.
All right.
Now I will remove the devitalized tissue.
Could you tell me what factors influence your choice of irrigation solution and technique?
Solution, the extent of contamination and the depth of the wound. Normally using saline under pulsed pressure technique because it is effective in debridement and less healthy tissue damage.
Excellent. And what criteria guided the removal of foreign bodies within a contaminated wound?
If visualize foreign body
Mhm.
or palpable,
Mhm.
all in for deep foreign body, we need to do image.
Okay.
Remove dead tissue. And we will apply.
Alia, what is the criteria for packing material selection in wound management post-debridement?
Depend on the need for drainage and the wound size and the
Mhm.
moisture management. Initially using saline week. Saline week. Now, we'll also want basic listen. Thank you, Mrs. Vida. I finished cleaning for your wound.
Mhm.
I want to document my procedure.
Mhm. Okay. Could you tell me what the immediate steps are taken post-debridement to prevent infection?
Notice any sign of infection like redness, swelling, severe pain or being unwell, you have to visit the near hospital.
Okay. And how do you monitor wound healing post-debridement in outpatient setting?
Through regular inspection of the wound and needed for change, for dressing,
All right.
and educate the patient about the sign of infection
All
and
right.
wound healing.
I complete my question. You have 20 seconds. Do you have anything you want to do?
Thank you.
You have 10 seconds. Do you have anything you want to add?
Thank you.
Okay. Excellent, Alia. I will just go quick through your procedure. You introduce yourself and explain the patient the procedure and complication, and you take consent, but you don't take the verbal consent or written consent. Am I right? You need to ask the patient, could you please written?
Do you mean she didn't take the consent?
Written. Could you please?
Written, no, I didn't.
Yes, written here is mandatory also to ask about it. I would tell the examiner I need to take a written consent. Okay? And
Okay.
you ask about the WHO checklist and you ask about allergy, but you didn't ask about the blood thinner medication. You add the 2 points, but you skip the last one, which is about blood thinner medication.
Yeah, Ali, I'm gonna get all of this in the school. Just check it now.
Just as Ali said,
Because
they are okay. Could you continue?
Because I think in
Yes, you are right.
checklist,
Yes,
after
in
that, I should ask in same.
Yes, in
But you said consider done escape.
Yes, in WHO checklist, yes, the patient name, age, and blood thinner medication, allergy, all the things. But we add there are 2 separate questions you need to ask about WHO checklist. Even you ask it already about the WHO checklist, which is the blood
Because
thinner
they are
medication
Okay.
because they are very important. That's why.
and the allergy.
Okay.
You give the numbing agent to the patient. You explain the patient this is a numbing agent. I will give you maybe a little bit uncomfortable at the beginning. After that, you will feel numb. Then you need to tell the examiner, I need to wait 5 minutes until the numbing agent work. Here, the examiner will tell you 5 minutes passed, but you need to say this to the examiner. Do you hear me, Alia?
Yes, because I asked my patient is I forget. Yes, you have to give an anesthesia. I forget.
Yes.
Sorry.
You start your debridement by washing from the central and going peripherally, but you need to do more than 1 swab. I see you put 1 swab and go circularly outward. Just
I make a 3 swab.
Yeah, really?
Yes.
I'm so sorry. I think I see 1 swab, but excellent if you did 3 swabs. Yes. After that, you did your debridement perfectly, and you dry the patient and packing, and you document the procedure. When I asked you about, do you have anything to add? Here, I mean you need to dispose your sharp pins into disposal container. So I asked this question twice to say this point. Otherwise, you did very good. Excellent.
Thank you.
Ali?
Yeah, tissue culture for debridement of infected wound. Yes, we can take. Yes.
Yes, regarding
we usually take from practical point of view for diabetic foot infection or any infected wound. We take cultures. We do that. I know some of you guys may think that the test tube will not come to their exam or it's not a common station. But believe me, you may find this station in the exam. Just prepare yourself for every single station. All of them.
Okay.
Muhammad,
نعم علي.
the swab, if it's not in the school, we're gonna add it. The swab of the womb.
It is in the school.
Okay.
So, the next station, yeah, it is very good. Excellent performance. The next station is, let me check, please. Is fine needle aspiration cytology. This is the other station which remaining about the final needle aspiration cytology and cannulation and the airway management according to the advanced Roma life.
Muhammad, what are about the most important station from the start?
Yes,
Like
we
the
did-
suture and
yes, we did it all, Ali. Just we have no tying. I
who
think
did the
Sahar-
suture?
Suture.
We didn't do the suture.
Suture.
Wound suturing.
Not
Yes,
done.
yes,
Not
wound
done. Not
suturing.
done. Suture not done. Not done.
Yes, suture not done.
Not done. Yes.
Yes, we did the nevus and the abscess and ordering theater.
And now we did the chest tube. Okay,
and
cool.
urinary
That's fine.
catheterization and chest tube.
Okay.
Order chest tube.
Yes,
Order.
we have-
Order list 1 and 2 done.
Yes,
Yes.
we have two major procedure we need to do it, which is suture and knot tying. The knot tying, I think, with Sahar.
Yeah, but
I
Sahar,
didn't see attend
okay.
this session.
Because knot tying is very important. Very, very important.
Knot tying
She
and
need to
suture,
attend.
yes.
Very. That knot tying and abscess that are the most. Okay, let's finish and then we will see what needs to be complete.
The other station about the fine needle aspiration and cannula and airway management. It's less common station,
next?
but we need to do it.
Okay, let's finish today. Okay, let's finish today. Who's next?
Fine needle aspiration cytology.
Who's doing it?
Let me check in the Telegram group, Ali.
Hi.
Oh.
Actually, I'm one who should do it, but I have an emergency and I couldn't prepare it. I told one of my colleagues, but she either didn't prepare it. I'm sorry for that. It's like miscommunication between us.
Okay, that's fine. If you have a seating at home and you wanna practice on a pillow, that's fine, and you can prepare yourself while Muhammad Kamal do his station, because Muhammad Kamal has
Yes, let me at the last because I'm in the hospital now. I'm on call. I will finish. I give you a call. Okay. Let me at the last.
I
Okay.
think this is the easy station. It's just like catheterization. You can
I just try to
yes,
to
do your
it
best.
now. Okay.
even if you don't have a needle, use a pin. Use a pin. I mean, use a pin to.
It's,
Okay, I will try.
it is already non-common.
Okay. And
station.
meanwhile, while Hajar preparing the situation, do we have another one who's participating today, Muhammad?
We have
Who's-
cannula and airway management.
Okay, who's doing the cannula?
Cannula.
Me,
Salma Zahran.
Salma
Yes.
Zahran. Okay, if you are ready, Salma, let's start.
Ali Hajar, I think she.
Hajar needs a couple of minutes, Muhammad, to prepare the situation.
She said that you can do it.
I know, but she needs to prepare, right? If Salma Zahran is ready, let's start with it.
Okay, Hajar, prepare for your station. Salma, ready? Hello.
Hello?
Okay. Your session is a cannula, all right?
Yes.
Let me put timer for you.
In the station, in the outside, will be written Mr. John, or I would ask the patient about his name.
Ask the patient
Because he
about the
is
name. Okay. Okay. Now 9 minutes started.
Hello, Mr. John.
Hello.
Good evening. I'm Dr. Salma, one of the surgical doctors here. Today I will insert an IV cannula to your forearm.
What do you mean by IV, doctor?
IV cannula, it's a device contain two parts, metallic part and rubber band part. I will introduce it. It will be some, you will feel some discomfort, but no pain.
Okay.
And remove the metallic part and keep the plastic part inside your vein. That to drop some blood for investigation and to give you some medication and IV fluids. And if we need to transfuse some blood for you, we can use it.
Okay.
You understand me?
Yes, I understand you.
You are following. Okay.
Yes.
You feel comfortable to start this cannula?
Yes, yes,
You
doctor.
agree?
Yeah, I'm agree.
Thank you for your cooperation. Just give me a moment to prepare my equipment.
Okay.
In a sterile sheet, I will open my cannula.
Will you give me any numbing agent, doctor?
Huh?
Will you give me any numbing agent?
ما سامع.
Will you give me any numbing agent, doctor? Okay, continue, please. I'm sorry. Continue, Sam.
Mr. John, do you have any allergy to any drug or you use any blood thinner?
No, I have no any allergies.
Now, Mr. John, I will put your arm in a sterile sheet also to ensure this procedure will be under possible aseptic condition.
Okay, I'm your examiner. I will be asking you questions while you're doing the procedure. Is that okay?
Okay.
Muhammad, the timer, make sure the timer is on.
Yes,
And
the time is on. Awesome.
Okay, how do you assess ven's suitability for cannulation in hypovolemic patient?
And I ensure the visibility and the vein is palpable and very visible. And if it is not visible, I can use ultrasound.
Okay. Continue.
I find this one, the vein. Mr. John, I'm cleaning, I'm cleaning the area where I want to insert this cannula.
Doctor.
Now I'm going to insert it. It's it's a little bit not.
Okay, doctor, continue your procedure. What will you do if your first attempt fails in putting the cannula?
I will remove it and compress on it for a while to stop bleeding, and I will change and I will change the vein, and I will search for another vein suitable for that.
Okay. How do you determine the need for large bore cannula in a trauma patient?
If the patient in shock, I will need this cannula to transfuse blood and to start resuscitation by IV fluid.
Okay.
After I finish, I just document the site and size of the cannula. Any
Document it now.
complication.
You have time, right? Document it now. Do you have a pen?
Yes, and I will discard the shot.
Document now. Write on a paper now and discard your sharp now.
Mr. John, I just wanted to document site 18 French.
Okay. I will ask you a couple of other questions. How do you educate the patient about cannula care to prevent dislodgement and infection?
I explain to the patient that the cannula site must be clean and dry, and he must not pull it or twist it. And if he feel any pain or any swelling, he must inform the nurse or the.
Okay. And can you tell me about the size of the cannula and what's the color of each size?
Okay. 18 is green.
Yeah.
20 pink. 22 blue.
Yeah.
24 yes, yellow. 28 purple. And gray 16.
Yes.
And the size 16 the biggest one or the wider one.
No, there's one that's bigger than 16.
Maybe I just know till 16.
That's fine. 14, which is orange.
Orange. Okay.
Yeah, this is updated in the school, by the way. We just we put an image in the school. That's all the question. Do we have other time, Muhammad?
I think we have 1 minute remain.
Okay, the session is finished. There's no more questions.
Okay.
Do you want to do anything, doctor? You have 1 minute.
I already checked the vacancy by saline using saline.
Okay.
And,
do you want to do another thing? Do you want to do another thing? You have 1 minute.
Yes, I want to thank Mr. John for his cooperation.
Thank him.
Okay. Thank him then.
Thank him, Selma.
Selma, say thank you, Mr. John, for your cooperation. Now we are done.
Thank you for your cooperation.
Okay.
Okay. Muhammad, start.
Selma,
Good.
excellent performance. You did your cannulation perfectly. I just wanted to comment through your examination from beginning. You introduce yourself and take permission, but I think also you missed the written consent. You asked me, are you agree about the procedure? And I said yes, but you need to take a written consent. You need to tell the examiner, I need to take a written consent. Is
Yes,
first point.
you know, Muhammad. Yeah, I just want to say a controversial point here.
Okay.
Yeah, usually from practical point of view for the cannula, we just go with the verbal one for the cannula. Yeah, we consider it as a very minor procedure, unless if there's if the patient refused before, or if the patient fought against the hospital. Yeah, but in general, we just go with the verbal for the cannula in general.
Okay. So you can skip this point. After that, you asked about WHO checklist and blood thinner and allergies. Clean the wound. Yes, I have no point again, Ali. I think she did all
Yeah,
the
there's no any
perfectly.
local anesthesia will be
I have
added for
one
the
point.
cannula.
Yes.
Dr. Ali, I have one point for myself. I explained the procedure, but I didn't mention the complication. I must say to the patient that it may be bleeding
Yes.
or swelling, or maybe it's wrong to artery rather than vein.
Yes. And
Yes.
did you say sharp scratch when you were about to insert the
Yes.
needle?
Yes. I am glad she said that, Ali. She said this may be a little bit uncomfortable at the beginning.
Yeah, but when she put the needle in, the moment that she put the needle in, she need to tell the patient sharp
Yes.
scratch now.
Yes. Before she put the needle in my vein, she said that.
Okay.
But Selma, I think Ali,
Yes.
who won the mention you need to dispose your sharp pins in the disposal container. You
I
didn't
already
mention
have
it.
my sharpened container and I disposed it.
Okay. I think it is white in color.
Yeah, just don't forget,
Yes,
even
so
for the cannula, thank your patient. I asked you what do you need to do, what do you need to do, and you lastly remember that you need to thank your patient. So that will give you a lot of marks. Don't forget to thank your patient at the end. That's very important, by the way. This will give the last impression to your examiner. You have 4 marks just for communication skills. Okay?
Otherwise, you did very good.
Thank you.
But otherwise, good. Your exam is going to be maquette. It's going to be plastic. The veins will be very clear, and the blood will be inside the veins. So it's not going to be a real person. They will not let you try on a person. It's not a common station, but it could come. That's the same with the chest tube. Chest tube is more frequent than cannulation, but prepare yourself for every single station. Don't say this station will not come to your exam. Because if it came while you are not prepared, that's a problem there. Okay, let's go to the next, Muhammad.
Ali, before that, you remember me point about the IV cannulation. Selma, I think you told me in explanation of the procedure, I will put IV cannulation. Instead of IV, say intravenous or plastic tube.
Okay.
Okay. The next station is airway management. According to the advanced trauma life support. And I think, let me check who will do this station. Seventeen.
Who's doing the air management?
Airway management.
If not ready, let's start with Hajar and then see who's doing the air management later.
Okay, no one choose it.
No.
Why?
Choose it.
Why?
I don't know.
Okay,
it does come. Air management does come to the exam, by the way. It does come, especially in the Gulf area.
Yes, it is more common than
airway management. It's more common than IV cannula, more common than urinary catheterization. So someone picks it for the next session. We're not going to do it now as long as. Sorry?
I will do it next session. I'm Hajar, sorry.
Okay. You are Hajar, but it shows Ibtisam.
Yes, she's my mother.
Okay. Hajar going to do it next session. Okay, let's do. You have the last
okay, I will
session
choose
today.
it for the next session, but I will try to do fine in the aspiration now.
Okay. Are you ready to do it? Fine needle aspiration cytology.
Yes.
Yes, to some extent.
Okay.
Yes, to some extent.
Could you please open your camera?
Just a minute.
I will put timer.
Okay, that's clear.
Yes. What is your nodule? This blue in color? Okay. Now I will put 9 minutes. Please unmute yourself, Hajar.
Okay, this is the lesion I'm going to do, and this my gauze, and this is for anesthesia, and the other one is the final aspiration, and those are the two slides, and this solution for fixation.
Okay, excellent. Now I will put the 9 minutes.
This is my heparin.
Okay.
Okay.
9 minutes started.
Okay, so good afternoon. My name is Hajar, one of the surgical doctors. Today I am going to take a final aspiration, and this includes me like pressing your skin and the underlying fascia. It may be uncomfortable, but I am going to apply analgesia in the area, so you are not going to feel anything. This operation is very important to us, as it's very critical in to know the diagnosis knowing. Is that okay to proceed?
Yes.
You said fine needle aspiration, doctor. What is that? What is fine needle? Can you explain again, please?
Like needle the skin and your underlying fascia to take sample from the skin, so we can diagnose through it what you are having. It helps us to diagnose, the diagnosis of the swelling you have.
Okay, that's fine.
You know that you are complaining of this lump.
Yeah,
Yes.
yeah, okay. So you want to know the cause of the of this lump, right?
Yes,
Fine, okay.
yes, we want to know the cause or the type of cells that found in this, and this will help us to reach the diagnosis. We may need further investigations, but this one is very important.
Okay, that's fine.
Do you have any other questions or concerns?
No. I think you can continue with it. I already signed my consent. I just wanted more explanation, to be honest.
Okay, thank you. You are doing great by asking. So I am going to start by using this heparin, and I will take sample through my needle, little bit, and I will flush it out. Okay. This one is ready. So I'm going to palpate here.
Oh, that's painful, doctor.
I'm sorry. I'm sorry for that. I'm so sorry. I'm really sorry for that. And if you have any pain during my examination, please tell me, okay? I'm going to clean the skin over the lump, okay?
Okay.
Yeah.
Okay. I'm just going.
That's very cold.
Okay, I'm sorry. I'm so sorry for that.
Yeah.
Okay. I'm going to palpate it again. Is that okay?
Yeah, just be careful, doctor. It's tender.
Okay. Okay, sorry for that. Okay. So we firstly examine the lump, then we clean it. Now we are going to use this syringe with heparin inside it, and heparin is type of blood thinners, make your blood like not making clots. And
yeah,
that
blood thinners. That's very clear to me, doctor. I'm not dumb.
Okay. Okay, you are doing great. Well done. So I'm going.
Okay, while you're doing your
palpate
procedure,
again.
will be your
Do you have
examiner
the-
too. I will ask you questions while you're doing the procedure, okay?
Okay. So I'm going to palpate again. I'm sorry it's hard, but I'm going to palpate kindly.
What are the key considerations
Now
when
I'm
choosing
going
to
to
apply
use
local
the-
anesthesia for fine needle aspiration?
Well, it's depend on the patient anxiety level, and also depend on the side of mass and the size and such consideration regarding the mass.
Okay. Describe the proper technique for ensuring adequate cell sampling collecting during the fine needle aspiration while you're doing it. Don't stop, please, doctor. Continue your procedure.
Okay. During I will firstly put my needle in after ensuring that the patient have no
Yeah.
pain, then I will apply pressure by taking the needle off like that.
Okay.
This making me apply negative pressure. Then I will do putting multiple time in the same direction firstly, then from other direction in the same place very quickly. Like
Okay.
that. Okay.
What are
After that, I will,
what steps are involved in preparing aspirate for cytology analysis?
I should do heparinization for the needle
Okay.
by taking some heparin and flush it out. And also I should consider the cleaning of the area, roughly cleaning the area. And preparing 2 slides, one for fixation by air and other for one by air, drying, and the other one by fixation.
Okay, can you do that now? Can you show me?
Okay. Okay, I will take off the needle and put it, and I will put this here. Then the needle I with aspirate. Then I will take the first slide, and I will put the aspirate I did here. Then I will bring the other one and slightly, I mean very, very gently put them together to make it spread. Then I will put the 2 slides and apply one fixating agent from distant space.
Okay.
And the other one I will do
That's
drying.
fine. What's the size of the needle that you used for the aspiration?
It should be a green needle, size 21G, 21G.
What's the significance of using heparinized saline in the fine needle aspiration procedure? Why we use the heparin?
To prevent clots inside the needle.
And okay, why are you preventing the clots?
I'm preventing the clots to ensure that I have adequate sample.
Okay. How do you manage a patient who experiencing significant anxiety about fine needle aspiration?
I will explain more for him about the operation and take all of his concern, and I will use local anesthesia. And maybe holding conversation with the patient during the procedure will help him with his anxiety.
What are the complications of fine needle aspiration?
Fine needle aspiration can cause infection, can cause bleeding, and pain to the patient.
What else?
And trauma maybe.
Okay, and how you minimize these complications?
I will minimize by using sterile techniques and proper aftercare for my patient. And if that's not enough, I will repeat the.
Okay, how do you determine that the need for fine needle repeat the fine needle aspiration?
Will this depend on the initial cytology report? And I will take this report and discuss it in the multidisciplinary team.
40 seconds.
And if there is other.
Okay. Do we still have time, Mohammed?
40 seconds. Ask her to have anything to do. Yes.
Okay, you have 40 seconds. What do you want to do?
I will take the samples and end my procedure by doing the air fixation and dryings and seeking for the report. And I will thank my patient.
Thank your patient now. Your patient is in front of you.
Okay, thank you. I will provide you analgesia if you need. And if you want to talk again about the procedure, I am open if you have any.
When I will receive my result,
questions.
Doctor, that's the only questions that I have.
Okay, as soon as possible, you are going to receive the report. We are doing our best to make it faster, and we need this report to be discussed in team with all the specialties.
Okay, good. Good. Time finished already, as Mohammed said. Generally, most of the final aspiration result will come back in 2 weeks. Just say 2 weeks, and then say, and if there's any delay, we will let you know. But approximately around 2 weeks. Don't say 2 weeks like it's 2 weeks. Say approximately around 2 weeks. Okay? Yeah, Muhammad, you can start.
Okay, very good performance. I just have 2 points, which is the most important point. At the beginning, you don't confirm my name.
Yes,
Even
yes,
during your
Muhammad.
procedure, you didn't mention my
Yes,
name
he
couple of
forgot
times.
that.
Just you take permission from me about the procedure. And Ali mentioned the written consent already. My second point about you clean the site of procedure and then you touched it by your hand again. When you clean
Yes, I know.
it's not,
During my
yeah,
exam.
that is not right. When you cleaning the site of the
Yes.
procedure, don't touch it again. Okay.
Okay.
Otherwise, you did very good. And the last point about the analgesia, you can say numbing agent, as Ali said previously.
Okay.
Also document the procedure and dispose the
Yes,
shaft
and I
needed.
wanna mention a point, Muhammad.
Continue.
Before you do the palpation, you should ask your patient, do you feel any pain before I touch you?
Yes, you have pain.
Yeah, so Hajar, don't forget the basics. You know the basics that
Okay.
we did as a start.
Actually,
Yeah.
because during
Sorry?
okay. Yes.
Sorry, I couldn't
I
hear
just
that.
forget that I'm going to deal. I forget that I'm going to deal with the patient. It's just like a station, a procedure station, something.
Yes,
not a
yes,
patient.
I know. Yes. You know the basics that we said from the start is like permission, patient name. Before you touch the patient, ask if he has any pain. These basics will carry on with us till the end of the procedures. And as you notice, that's why we advise everyone to practice, because it's very easy to forget the simple stuff. Okay. I think that's all. I don't have any other point. Otherwise, this station probably will not come to your exam. But we practice it anyway. We just want to make sure if it came to your exam, you are aware of it.
Yes.
And you know how to deal with it. Debridement of contaminated food, final aspiration, cannulation. They are not that common. Airway management in Atlas patient comes in Gulf area. That's why I'm going to change it now and make it with the commonest one. So it's updated now in the school. You're going to find it with the most common procedure skill. It's very important. The airway management is very important. Okay, it came for once only in Khartoum. No. It does come in. Yeah, you are right. But it does come to Oman. It came to Oman. It came to Oman, and it came to Oman a couple of times. By the way,
Khartoum.
There's a high chance for it comes into Abu Dhabi. I'm not sure if it came yet, but we will practice it. Okay.
So I think no one choose to do this airway according to the Atlas airway management. So is there anyone ready to do this station at the exam?
I will do it next session. Yeah. Write that in the Telegram group, Hajar, so we can confirm it for you now. Muhammad Kamal said
we have to.
Muhammad Kamal said he needs 10 minutes, but
yes, just 10 minutes, just in my way. I am to home.
Okay, there's a couple of points I want to discuss with those who having the exam in all of our participants are in August. I'm guessing. I was thinking that my student already had high exam, Muhammad, but we cannot reach her. We want her experience. We want her update, so we can.
Yes, I will contact her today, inshallah.
Yes, we want her experience. We want her like what was
updating
like what the new questions, so we can update them in the school.
All right.
Muhammad Kamal.
I think he's driving.
Yes,
now.
yes. Yes, I can hear you. Yes, say.
Okay, continue in your driving. Don't get into crash accident now. So for everyone attending, we have like 6-7 minutes till Muhammad reads.
So Ali,
do you have questions that you need to answer?
Hello, good evening.
Yeah, Muhammad.
good evening. Continue.
Good evening.
I supposed to do the suturing last time, but I can't get my kit. But I can do it if Dr. Muhammad will take a
Do
time.
you have the kit now?
Yes,
Good.
I have it.
You can do
Let's
it now.
then.
Let's do it, Ibrahim.
Yes.
Yeah.
Open your camera.
My son and Asia, both of them, I think. Right?
No,
my
no,
son
my son
was on
just-
6. No, Asia didn't take her exam. She wasn't able to travel, but my son did.
Ibrahim, could you please open your camera and are you ready?
Yeah, you can see it now.
Yes, I see it.
Very good.
So you will do suture, wound suturing.
Let me
Okay.
open. Also sharing, that's a very important station.
Ali,
That's very, very
here
important station. Yeah,
you will be the examiner and I will be the patient, okay?
I will be the examiner. Okay. Put the timer then.
Okay.
I'm gonna put the timer to
Ibrahim,
this very station. Very important station.
Ibrahim,
Yes, you can see it.
during this station, Ali will ask you a few questions during procedure and I will ask you during the procedure because I am patient and he is the examiner, okay?
Yeah, it's okay.
So don't stop during
So we're
procedure
gonna
while Ali
test.
asking.
We're gonna test you today. We're gonna test you hard. So I will be talking to you. Muhammad gonna be talking to you. We don't want you to stop suturing and doing what you're doing while you're answering. So when you answer me and when you answer Muhammad, answer while you're doing your procedure.
Before starting, may I ask a question? Do I have to choose which one?
Sorry?
Before starting, may I ask you a question?
Yeah, I will answer Muhammad Yusuf in a minute. What did you say, Ibrahim?
Which suture I will do?
Interrupted suture. Choose the
which one?
No, choose the longest one. The longest
For the straight?
The longest straight one. And I want you to make
This
that
one?
Five. Yes.
let me see. Let me see. I don't see. Let me see it first.
This
I
one?
don't see your screen, to be honest. Where is your screen?
Yes, I'm speaking right now.
Yeah.
Yeah, I'm speaking.
No. Again. Speak again.
This one? Here?
No.
Or this?
The one below it. The one below it.
This one?
Yeah, this one. Yes.
Okay.
This one.
Okay.
And closing from A to Z, it's gonna be difficult for you. It does need like 6 sutures. In the exam, probably they will ask you to do 4, but I want you to close all of this in the 9 minutes while we're talking to you. But before you
I will
start,
try my
suturing or doing any of these procedures? How can I maintain eye-to-eye contact while proceeding?
you don't need to maintain eye contact for the whole procedure. You can just raise your hand to the examiner, start answering, and then put your head back. So, okay, let's say I'm suturing now, and my examiner asks me what type of local anesthesia you're going to use. I'm going to raise my hand. I will choose lidocaine, and then I will continue. This lidocaine going to be 2%. I'm going to use this milligram, if with epinephrine, if without epinephrine. You cannot maintain eye-to-eye contact while doing the procedure. That's very difficult.
So it's not like the history station. So it's
yeah, and it's not expected from you to maintain eye-to-eye contact. But
a short-term eye-to-eye contact is enough.
Yeah, you can raise your hand, give him a glass, and then get back to work. You don't need to. How you can suture while you're talking to the examiner? That's not possible. In my abscess, during my exam for the abscess draining and for the suture, I have no eye contact with the examiner, except for the last 2 minutes in which we have a direct conversation after I finish everything. But during the suture, I didn't have any eye contact. I couldn't. How you like even I didn't even have a glass to the examiner.
Yes, your
He will
contact
ask
with
me-
patient, yeah.
Yeah, I will contact my patient because I can see the patient is in front of me, but the examiner is on my back, on the side, on this side. I cannot turn like this and then come back. But the examiner is in front of me, right? And the examiner is concerned about how you contact the patient, not how you contact him. Do you understand?
Yes, well understood.
So the examiner will notice how you speak to your patient, not how you speak to him.
All right. Okay.
Okay. Ibrahim. Ibrahim, open your camera and let
Yes,
us
I can hear you.
put 9 minutes to start.
Okay.
Okay.
Start now.
9 minutes started.
Hello.
Hello.
Hello. Good evening. I'm Dr. Ibrahim, one of the surgical doctor. May I confirm your name and age, please?
My name is Jack. I am 32 years old.
Okay, nice to meet you, Mr. Jack. Mr. Jack, today I'm here to approximate your wound. That include me doing some stitch and giving you an numbing agent so that will be a painless procedure. And it may carry some risk of infections and delay wound healing. Is that okay with you?
Yes, doctor.
Okay, I want to check that you have signed the consent.
Yeah, he signed the consent here. That's his consent.
Okay, that's good. I would like to check the WHO checklist.
We check the WHO for you. It's all in place.
Okay. Before the procedure, I just want to confirm that. Do you have any? Do you take any blood thinner?
No.
Okay. Do you have allergy to any numbing agent?
No, I have no any allergies, doctor.
Okay. Now, just I will prepare my equipment.
Okay.
Okay, your equipment is here already. I will be your examiner as I said. I will ask you questions while you're doing your procedure. Okay.
Okay. Okay. I will first check my equipment. It will be under aseptic condition. Firstly, I will check also for the suture, and we check also for the lidocaines, its concentration, and also it is sedative effective.
Okay. What the dose of the lidocaine that you're gonna use, doctor?
3 milligram per kilogram for 1% concentration.
Okay, and you are allowed to use up to?
I can use up to 20 mils, and I can use up to 7 milligram per kilogram if the patient is having, if I give it with adrenaline. Okay, now I just want to inject this numbing agent, okay?
Already injected, Ibrahim, numbing agent.
Okay, I will inject it here, right in the just around your wound, okay?
Okay.
Yeah.
It may be a little bit uncomfortable. Okay, I need to wait about 5 minutes for anesthesia.
Consider 5 minute pause.
Okay, now just I want to check that it works. Okay, if you feel pain, tell me. Okay.
Okay.
Do you feel any pain?
No.
Okay.
No. No, doctor.
Okay, that's nice. Now we can carry on. Did you take anti-tetanus vaccine?
Yes.
That's good. Okay, now I'm going to start approximating your wound.
What the size of the needle that you use for injecting the local anesthesia, doctor?
It will be for injecting, I will use 25. And for taking and for aspiration, I will take 21 gag.
Okay.
Are you comfortable?
Yes, doctor, but I am really worried about antibiotic. Will you give me any antibiotic?
Okay, your wound is look clean. But if there is any sign of infection, we can consider that. Okay.
And how about showering out?
Just I want to give you some advice. Okay, I want to give you some advice that you have if you find any sign of infection, you have to visit the clinic. This include if you feel spike temperature, is there any redness around your wound, you have to visit the clinic. Okay.
Okay, doctor.
Can you tell me what the type
regarding
of the suture that you use, doctor?
No, I'm using monofilament, non-absorbable
nylon. Okay.
Nylon. Sorry for that. Okay, I want to advise you just about the dressing.
Okay.
You have they want you to do that day after day. Okay.
Okay.
Why?
Of infection as in case of abscess, and also it is good if you can just take some. We can we don't have to take all the suture if there is any.
Okay. What's the mechanism of action of local numbing agent like lignocaine or lidocaine?
It's work as a sodium channel blocker in the membrane of the nerve.
Okay, and how it help you with the dosing?
Allow me to use a more dose. For example, from 3 I can change up to 7 milligram per kilogram, and also it take increase the duration. So I can do it will take a longer time for the anesthetic agent.
Okay.
And also decrease the systemic side effect of the anesthetic agent.
And what's the advice that you provide for your patient regarding the lifestyle, showering, and the rest of it?
I will advise him to cover the wound and try to avoid it to get wet, and dressing the wound after 24 hours, and then every day, day after day. I will also advise him to take protein-rich food so that he can enhance his wound healing.
Okay, can you tell me about 2 waterproof dressings that commonly we use?
Could we skip that, please?
What are the most common side effects of local anesthesia?
This include numbness, nausea and vomiting, and arrhythmia, and neurotoxicity.
Time finished. Okay, time finished.
Okay.
Ibrahim. Start Ali because I have poor internet connection. Start to connect.
What you want to do now? Let's say you have 20.
Internet
20 seconds.
Okay, thank you. I want to dispose of my equipment. Thank you so much. I would like to see you after after 7 days to take your sutures. Okay.
Yes. Okay. So, Ibrahim, show me the tube.